As many of you know, the brain is really, really complicated and it develops the most over the first 5 years of life. And that is why you working in the early childhood profession are so impactful for the children that you care for and about. And this is important to remember because even if a child, a young child, they may not remember what you said, what you did, what you looked like, maybe even your name, but that child's body remembers how you make them feel. And their brain remembers how you make them feel as a young child. So please keep that in mind because sometimes when you say goodbye, and I know family childhood educators, you have really strong relationships with your families, but you may wonder about those that fell through the cracks. And those kids remember you and very, very impactful stuff. This is especially important for children with autism because it is a neurodiverse disorder. So that means that the changes in brain structure, function, and development and the symptoms that we talked about at the last Autism Series event. So those challenges in social communication and repetitive behaviors. But before that, we are going to just go through a few general sections of the brain before we dive in how this is different for people with autism. So the first portion of the brain that we're going to talk about is the cerebellum. The cerebellum sits at the bottom back of your brain, and it is responsible for balance, movement, and motor learning. And this is the most developed at birth. And there's actually research that is showing that it may be involved in your active state, your flight or fight response as well. Oh, and I did want to let everyone know in person and online, these were given to all participants in a handout virtually, and I know my in-person participants have it in their hand, just because we don't expect you to remember all of these things. It was on the side, and now it's gone, so if you need to reference back to it throughout this training, please do, or have it pulled up on a different window if you're attending virtually. The second part that we're going to talk about, part of the brain, is the limbic system. This is the core of the brain. It's a very ancient part of your brain, and it is responsible for memory and emotion. So this is the part of the brain where all the sensory information that you as a human is taking in throughout the world, it is coming in and it is figuring out how to make it comprehensible to you as a person. So it also has something that is called the corpus callosum, which is this half moon structure in the middle of the brain, and that kind of acts like your brain's belt line, your highway. It helps different parts of the brain talk to each other, and it acts as kind of a highway system for the brain for messages to travel. And the last part, this is the least developed at birth. This is the cerebral cortex, the meaty part of the brain that you can see in your Halloween decorations. That's the cerebral cortex. And this is the thinking part of the brain. This is the part of the brain that is involved in emotion regulation, executive function, planning, decision making, and this is a portion of your brain that is still developing and changing until you are in your mid-20s. And I know that people with young adults as children will probably agree to that. So let's apply this information. What do you think is going on in the limbic system, or the emotion and memory system, for this little infant pictured here? So we're talking about the limbic system of the brain. Do you see it? Is there a feeling associated with this infant right now?
She's feeling sad.
Yeah, she's feeling really sad. Her brain, something is wrong. And she is doing what babies know how to do, and that's cry to let their caregiver know, I do not feel good, something is wrong. Maybe she's tired, maybe she's hungry. But that's what's going on in the brain. The limbic system is firing. Something is wrong with my body, and I need a caregiver to help me. And as children grow, that limbic system, you learn new skills and you're able to recognize different sensations like hunger and tiredness. And that's when different parts of the brain start working together. And but not for this little one right here. She needs a caregiver to suit her. Okay, this one's a little bit harder, I think. What do you think is going on in the cerebral cortex for this child pictured here? Playing with a dinosaur and a helicopter. This is the part of the brain that's involved in planning, decision making. I wonder if that child is thinking, this is my dinosaur Roxy, and Roxy's gonna take the helicopter to the faraway land and gonna go live there. This is what's going on in the thinking part of the brain when a child is playing like this. And now we're going to talk about how this differs for children with autism and people with autism, because it is a neurodevelopmental disorder. And we're going to look at some of what the research says. So there's something in your brain that's called the amygdala, and this is the main emotion center of your brain. And research is showing that children with autism have an enlarged amygdala. And the theory is that because autistic people struggle so much with processing sensory information, that it could cause this overgrowth. So that's one difference. It's kind of this section over here. Oh, and the amygdala is also involved in facial recognition and response to threat. The cerebellum is also affected the balance and motor learning center of the brain. Research is showing that autistic people have decreased amounts of tissue in that area. So I know that there was a question that came up around children with autism toe walking. That can sometimes be something that people see. Not for every child, but this might have something to do with it, is that the cerebellum, the portion of the brain that is responsible for balance and motor learning, there's decreased amounts of tissue there. And the cerebral cortex, that is also affected for autistic people as well, where on average, you'll see much thicker cerebral cortex, and that increases the distance that a message has to travel across the brain. We're going to talk about something called the connectivity theory of autism. So this is just a graphic to show you what the brain should be doing. Our brains are really efficient machines. They should be processing information freely throughout the brain quickly, and as we grow, it becomes even faster, and we cement those highways in our brain. And that's why creating healthy patterns early on helps us become healthy, happy adults later in life. But for autistic people, because of those changes in their brain structure, function, and development, they have a lot of short-range connections and less long-range ones. And I'm going to show you some brain scans that really highlight this. So here we see a picture. So this is, you're looking at a brain. This is a brain scan. And when you look at a brain scan and you see colors in there, that's indicating that there's oxygen going to that part of the brain. Because when your neurons are firing, it releases oxygen. So whenever you see a brain scan, that's how they know if, quote unquote, part of your brain is lighting up. So as you can see, this is the brain of a 4-year-old child who is receiving center time instructions. And it looks like a river. See that corpus callosum is working. It's helping long-range connections flow freely into the brain. And I'm sure this child is processing the information that she is receiving. Now, this next picture that I'm going to show you is a 4-year-old child in the same classroom, receiving the same instructions, but this child has autism. So it looks a little bit different, doesn't it? So this looks more like a flood to me. And this is more centralized. So this is helping show that connectivity theory of autism. There's a lot of really close range connections firing in the brain, and it's hard for people with autism to process information because of this. It just looks like a headache. It's no wonder that we see so much distress and non-compliance from autistic children. This is what's going on in their brain. So how can we help them? We had already talked about in the last session how children with autism struggle with language and communication. So as many of you may already know, visuals are a great way to help all children process information more quickly, feel like they have concrete ideas and they have agency to know what to do. And we today, if you are here in person, we are going to be making some of these that you can bring back, sort of as starter packs. And I'm going to talk about each of these right now. So the first Zen board is kind of what it sounds like. You show a child this is really good for transitions, going from one activity to another. But the key is for the then activity, when you show a child the then activity, it should be something that's more desirable than the first. So showing the child, first we wash our hands, then we eat. Or first we nap, then we play outside. And that's kind of how you would say it to a child, and you would show them the visual, because and part of the reason why visuals are so powerful for young children is that when you're using your words and then there's silence, the words are gone. But when you use a picture, it's concrete and visual, and it stays there, and the child can look at it and process it. It becomes a concrete idea for them. The choice board, these are really helpful for children who struggle to remember all of the options that are available to them. Maybe at free play time, they're always wanting to just go outside. I just want to go outside, but it's not an option right now. And that can be really challenging for some kids. So the choice board can be helpful to just show them visually what's available to them that they can use right now. And it'll be easier for them to make a choice and a decision if they have it laid out in front of them. And then they can feel like they have independence to make that decision for themselves. So that will help with some of those big feelings that come with being overwhelmed, not knowing all of the options that are available to them. And the last one you guys are going to make today is the communication ring. These are helpful for all children. You can use, I have one right here that I made. They're on a ring. You can hang them on your belt loop or on a command strip on the wall. And these are just really helpful, especially for when children are having big feelings, even in transitions, just showing them a picture. Nap time. It's time to rest. Can be really, really impactful because it makes the direction something that's not going away, like your words do. And there's different ones too, and I'll have you guys go ahead and at the end, you can kind of look through those and make one that would be useful for your programs, because every program is so different. But there's one for cleaning up even. And these are just to start you guys off, because really the most impactful visuals are pictures of the child doing things or the activities and materials that you have in your programs or available to you. So this is just to dip your toe in the water and see how this could work for you in your programs with your children. If you have a child who's really struggling with transitions, try the first Zen board. Try the communication ring. At first, we often see that with visuals, there might be a lot of negative emotions that come from showing them a visual, but stick with it, because then they start to realize, oh, it's not going away. And I guess this is just a way to communicate now. But at first they can be really upset with it because it makes it something concrete. Like wash hands. It's time to wash your hands. And when you just say that, it's more, it can be more, oh, well, they said that, but I'm not really feeling like washing hands right now. If you show them a visual and say wash hands, you can even give it to them to hold. That makes it something concrete. And oh man, I really do have to do this, don't I? So I think you'll be surprised, and I hope that you can get a lot of use out of these, and then maybe grow and create your own over time. So with that being said, does anyone have any questions before? Oh yes, there's one in the chat.
How many choices should you give the child, and will too many options overwhelm them?
How many choices should you give the child, and will too many options overwhelm them? That is a really great question. It depends. It really depends on what's available. What are the choices that they have? Right now, the choice boards that we have here, there are 6 options. If they have an option to go and play in all of the centers or the play spaces that you have in your programs, then you might want to offer a bunch of options. Now, if you try it and it seems to be really overwhelming for the child, then you can make it simpler. Just try 2. Start with 2. They're having a hard time making a decision. Give them that independence and ability to pick a choice between 2, and then maybe over time you can increase it. But it really is dependent on the child and their age and developmental level. So thank you, Amy. So Jen, thank you for joining us. You're supposed to be Gretchen. Here in the form of Gretchen. Yeah, Gretchen. Becker Prav is supposed to be joining us today for a family emergency. So we have Jen Bluske filling in. Thank you so very much.
Yeah, happy to be here.
Is an occupational therapist, correct?
I sure am. Yeah.
Yep. Okay, so I'll let you speak more.
So my name is Jen Bluske. I'm an OT and a parent coach, the Children's Therapy Network, and I started working with Gretchen in I think 1999. So we have been doing this work together for a long time. So I'm happy to be here talking about sensory processing. So I'm going off of Gretchen's presentation. So if I look a little confused with the slides, that's why, and I might just deviate to my own here at it. But love talking about sensory processing and how it impacts children and their behaviors. And so what we're going to talk about tonight is we're going to make sure we understand what sensory integration is, what our sensory processing systems are. That information is the foundation for how we decide what to do when kids are struggling. Behaviorally, it's one of the lenses we look through. This sensory processing work applies to our kids with autism. Later on in the slide, it's 40 to 90% of our kids with autism have sensory processing disorders. So it's a very high correlation. Then we're going to talk about some strategies. We're going to talk a little bit about co-regulation and regulation, what you guys can do for yourselves in order to be able to support some of the behaviors or challenges you see, and then thinking about environments a little bit. So the video in a nutshell was a little boy got his teacher to sent on the floor and was very sad about it. His teacher said, "I'm sorry, we don't have any more peaches," which you guys heard. And then picked him up and removed him from the snack room into a playroom. At which point he started throwing a few toys. She removed the toys, tried a few more times to throw some toys, and then he put himself in a tiny lining or a tiny little house. And so that's the video. And so that video is a really interesting video to think through when we're thinking through sensory processing, and when we're thinking through co-regulation, and when we're thinking through behavior. So I'm going to keep referring back to that video. I want to think about it through this sensory processing piece. So let's start by defining sensory processing. It's the ability of our brains and our nervous systems, the nerves running throughout our bodies, to take in information, put it together to make sense of it, and then do something about it, right? So it's that ability to, actually, you just saw it happen. I walked backwards and felt this cord. I just tripped over a power cord, and my body took in the information and adapted, and I took a step back from a balance perspective so that I didn't fall over, right? And I did that mostly successfully while talking. So that is sensory processing in action. Our children are learning how to process sensory input from in utero, right? So this turns on in utero and it's going on the whole time, right from birth all the way up to adulthood. Each person's sensory system, so each person's sensory system in the term and online has their own unique story. So mine is different from yours, it's different from the next person. So we are all inherently processing information differently, which makes it very interesting and unique, because if we're looking at a child who dropped their peaches on the floor, their sensory experience is different from ours. So it takes us as adults to have some awareness and some problem solving about, I wonder what's going on here. Okay. All of our sensory processing patterns, all of our defaults have advantages and disadvantages. An example might be, some of us might need a lot of input, right? We might need a lot of activity in order to be able to engage in our world, right? That's an advantage, right? I can take in a lot of information and do really cool things with it. It could also be a disadvantage if I'm asked to sit still at 7:20 at night and listen to somebody talk, right? If you need a lot of input, that's challenging. And by the way, if you're in this room or online and you really can't sit still right now, don't stand up and walk around. That's totally fine with me. You use your sensory system the way you need to. So we're all different and inherently different in how we process sensory information. So this chart you're seeing right here, what this kind of outlines for us, it's a very busy chart. There's a lot of information on it. I'm not going to go through it in full. But what it shows is how our sensory systems, which we will go over in detail, build our skills. Okay. So I think that one of the questions was what was the question? Not when do memories start, but when does this all start? And your answer was right at birth. Yeah, that's down here, right? That's way down at the beginning when we're just learning, like, woo, my hands, I can see my hand and I can feel my arm move. Right now, that's not happening cognitively for the baby, but that's what they're doing. Right? So our sensory systems are going to build into our attention, they're going to build into our modulation, or our ability to take an input and figure out how much we can take in to be able to filter things out in our environment. They're just going to build into some of the the cortex skills, right? That functional communication, memory, some of the executive function skills. Therefore, if we're seeing challenges, sometimes with some of those higher level skills, we can support it through some of our sensory systems. So let's talk for a minute about behavior. Right, there's a couple of different lenses that we can look through from when we're thinking about behavior, right? We just saw a video with a child having a behavior, right? He was on the floor, he was throwing toys, right? It doesn't look real great. It's not real adaptive in that moment. He was doing his best to manage that big emotion. But from the moment we're born, our behavior is communicated through our interactions and through our bodies, right? We use our bodies and our interactions to help make sense of our world. And so when we think about behavior, we always want to dig under it. What is actually happening? What is actually going on right now? One of the lenses, the lens we're going to be looking through tonight, is sensory processing. Another thing we really want to consider is that different combinations of sensory patterns are different in different cultures. Right, this is nature versus nurture. An example might be that in some cultures, quietness, stillness, right, is valued. And if that's valued, our sensory system of being modulated, our sensory systems being modulated not needing a lot of movement might be valued. In some of our cultures, a lot of movement, a lot of expression, a lot of activity might really be valued. Right, so our sensory patterns and our sensory systems might be nurtured differently. All of it's okay, all of it's fine. What we're looking for is an adaptive response to get function from a sensory perspective. It's useful and necessary to have curiosity and openness around this so that we can figure out how to support each child within all of these contexts. So we're gonna start digging into the sensory systems. I'm gonna ask for a little bit of like feedback here. What are your guys' sensory preferences? I know I haven't gone into the sensory systems yet. But when I say sensory preferences, what pops up for you? What are things that you're like, ooh, I really like this, or ooh, I really don't? I will start, don't put a turtleneck on me, or I might be irate. The sensation of maybe you too. Like, no. The sensation of something around my neck is not comfortable, and I will not be able to be alert to the rest of my environment with a turtleneck on my neck. So this is why this is so important. This is actually half the battle. I do parent coaching as the other part of my job. And half the battle is understanding our own systems, right? Because if we're working with kids, they're loud. They bump into us. They throw things at us, right? If our systems are really sensitive, we have to have awareness of that so that we can regulate, so that we can co-regulate, which we'll get into. We cannot co-regulate a child if we're not regulating ourselves. So I would have you all consider, like, what are the things that really feel good sensory-wise for you? So that's going to be your clue for yourself in helping some of your kids. Okay, I'm going to go into the 8 sensory systems. I'm going to give some examples. I'm also going to give, because we're talking about our autistic kids or kids that we maybe wonder if there's upcoming diagnosis. I'm also going to just what clinically I see some of the time with our kids with autism, and what I see with our kids with sensory processing disorders. Okay. If you remember one sensory system tonight, this is the one to remember. This is the one that the strategy is going to be often really useful for you all. So our proprioceptive system, this lives in our joints and our muscles. Okay, so in our joints and our muscles is our proprioceptive system. Like every time we get input into our joints and our muscles, that's what when your husband, that's kind of when your husband's like squishing you. It sends something up to our brain. It actually lives in our cortex that tells us, ooh, my arm just moved up to my head. Right? That's my proprioceptive system working. You can't really separate these systems, they all work together, but I'm separating it just for the sake of learning. So it gives us information about where our body is in relation to self. It also gives us information about force modulation, right? So how much force I need to use in order to affect change on something. So how many of us have kids that are constantly slamming into us or slamming into other kids? Yeah, right? Or that are like breaking the toys. You're like, what you just broke the toy. They're like, right? That's a force modulation issue. On the opposite side is the kids who might be coloring or drawing, and it's like you can't even see it on the paper. It's a force modulation issue. But usually we see it's easier to see the opposite way. What those kids are seeking is to figure out where their body is in space. So it tends to look kind of behavior-ish, but it often is serving a purpose in order to get sort of that input into their bodies. Our kids with autism, sometimes we see sort of like the head banging. Do you have any like sort of head banging or bumping themselves? Okay, that's a proprioceptive input. Sometimes that's not the reason our kids with autism are doing it. Sometimes there's some pain associated that we end up figuring out through some medical supports, but that's a proprioceptive issue. Biting is proprioceptive, right? When kids like turn and like bite their friend, they're seeking proprioceptive input. It's also sometimes a really effective way of communicating, right? Because what happens when a kid bites, everybody comes running because you're trying to help the kid who stop bitten. But it's typically starts as a proprioceptive issue. So developmentally, kids are kind of going through that phase from, I don't know, 6 months to 12 months anyway. And sometimes it just kind of keeps going. So proprioceptive activities, when we're thinking about strategy, or when we're observing a child and we're like, whoa, they need a whole lot of proprioceptive input, or how do I stop them from banging into their friends? Or they're so rough with their toys, I wonder what I do. Here's our strategy. So any input that they receive through the joints and the muscles is going to most typically have a calming and organizing effect on the system. Not every single time, but most of the time, right? It's and this is why, like, this is the strategy to try. Pushing, pulling, lifting, carrying, crawling. From an oral perspective, this is chewing, sucking, blowing. So this is where we give kids stuff that's heavy. This is where we really support, getting on the ground. Anything on the ground is going to be more proprioceptive in nature than upright. I love these legends here. That is so proprioceptive because I can see what all the kids do, right? They're rolling and they're jumping and they're climbing. That is all proprioceptive input. We could also provide proprioceptive input just through our child-adult interactions, right? This is the like row your boat game, right? This is the squish game. This is the pull me up game, right? Pull me up some more. I need help getting up. Any of these things are proprioceptive in nature, and typically are going to help modulate that system a little bit. Any other proprioceptive strategies that you guys are using that you're like, this works really well? Kids who need this input, they seek it. They do a nice job of seeking it. Sometimes it's not super appropriate, right? It's something that we don't necessarily want, so we need to adjust it. Again, get down and play on their tummy. When kids are struggling to sit at a table, I'm usually like, yeah, good idea. Probably shouldn't be. I get them down. I get them down on the ground, on their tummy. I get them curled up in the ball in the corner to get all of that input through their back or up through their tummy. Tummy time for older ones also does a lot of other really cool stuff, but it is very proprioceptive in nature. Absolutely. Oh, here's some pictures. Like the pulls, anything like squishy, right? That kids have to like work harder to walk over is useful. I have just put pillows on the floor in homes. All the time. I love the Legos upside down. I've never seen that before. That's very cool. So that's the pushing, right? That's the pushing. Our next sensory system that I like to talk about is our vestibular system. So this is our movement. Again, we can't separate these truly, but for the sake of learning, we're going to separate them. Our vestibular system is housed in our inner ear. It tells us which direction we're moving. It tells us how fast we're moving. It tells us if we're tipping. Right, so that was when I tripped over the cord. That was my vestibular system that started it. Tactile system a little bit. I felt the cord on my feet. I don't know if she has it on here. She doesn't. Our vestibular system also gives us our relationship to gravity. So like, I don't know how many of you thought about gravity lately. I have not. I just kind of know that I'm here on this earth, right? I know that I'm just like, oh, I don't have to think about it. If you have a vestibular disorder, sometimes that's not a given. So imagine trying to go through the world and not quite certain that you're connected to the earth. These are our kids that we see that sort of like split. around the room and sort of never stop flitting. They're like, you know, like little butterflies. Our kids that never stop moving, they never sit still on a chair, right? The ones who are like hanging off the edges of the chair, falling off the chair. I don't know if you guys have seen kids that are they're sitting in the chair 1 second and the next second they're just off the chair. You know how that happen? Vestibular in nature. Our vestibular system is incredibly tied into so many things. It's tied into learning. It's tied into posture, coordination, how we use our hands and our eyes together. If we have kids with histories of like ear infection stuff, sometimes this gets a little bit muddy, right? If we have kids who early in life didn't get a lot of movement opportunities, or kids who have been in lives, right? Our vestibular system is often challenged. Our kids with autism, right? Sometimes we see like spinning, right? They're seeking that input to find their connection to the earth. And so again, functionally, when we see this as providers, as parents, as caregivers, we go, you're really looking for some movement. All right, now how do I do this in a way that supports their function? Right? So it can be swinging, right? Well, we don't all have swings available to us. It can be swinging, but it also can be upside down play, right? It can be just rolling around on the ground. It can be jumping, it can be vestibular, it can just be rocking, right? Especially for our littles, like how many of us, right, do this with our littles? That's vestibular. So here are some of the classroom examples of vestibular. Upside down, again, upside down play. The upside down play is a big one. It's one that, again, if you're thinking about vestibular for kids, input for kids, upside down is very cool. It tends to work really well. Any vestibular activities that you guys are finding that work in your spaces? Anybody online? I've seen my kids used to be at a child care center, and the teacher would actually set up periodically just some little like jumping obstacle courses in the classroom, where the kids would get some nice movement and some nice vestibular input with just like pillows and a few benches, but they were able to get that input in a really organized way. Okay, let's talk about touch for a minute. So touch is the first system to develop in utero. It's the one that's the most common when babies are born. It gives us our understanding of what's safe, and our touch system has two main purposes. It's there to help understand that what's touching us is safe or not safe. It's our protective system, right? So if a spider is crawling on my arm, I know it's not safe, and I'm gonna swap it off or do something about it. Okay. The other thing it does for us is it helps us to discriminate touch. Like, what is the quality of the touch? Right? Is it wet? Is it dry? Is it sharp? Is it the person online who likes the different textures, right? The different textures. The interesting thing about touch and the development of touch is it requires a lot of exploration. Right? So babies and children need a lot of exploration of touch in order to develop the system out. If for whatever reason this hasn't been available, or if their sensory systems are processing differently, right? An autistic brain, a brain with sensory processing disorder, that discrimination sense isn't going to get strong because the body is always going to be protected. So how many of us know kids that, right, like something bumps into them and they have this big giant reaction? Yeah. So that's that touch system that hasn't learned how to discriminate and is just stuck in the protection all the time. Right, kids who don't want to get their clothes out. Okay, kids who, right, this is the getting the winter coat on, this is the washing, like, I don't want to wash my hands, I can't wash my hands. Well, is it a tactile thing? Right, is it a tactile thing about the soap? Or the wet to dry, or the dry to wet? And so when we're looking through this lens of behavior, and as we're implementing the choice cards and the first then cards, we're at the same time, right? First, we're gonna wash our hands and then we're gonna eat. Oh, I wonder, right? Our brains, because we have this information, are gonna start problem solving. We're still gonna wash your hands before we eat, because that's what the first then card says. But is there a way to shift the wash hands to make the sensory experience make more sense for the child? Maybe. Maybe, right? If we're seeing sort of a pattern. And so this is how you use some of those strategies together in order to support success, right? What we want is an adaptive response. So the pressure and the speed of touch can impact the physical and emotional response. So we all know kids who love like their back scratch, or some of us, right? That light touch, love that light touch. In general, light touch is going to be more alerting to our system. And in general, we're not trying to put our system on edge. In general, we're trying to keep it organized. Deep pressure in general, so deep pressure is hard, not abrupt, but hard, deep input into the body is in general going to be more organized and calming for the system. So again, as providers, knowing this information, how are we going to touch children? We're typically going to make sure it's known. We're going to have it be deep pressure. We're going to stay away from this light stuff unless it's requested, and unless there's some communication that it's wanted. But so, for example, the tickle game is never going to be something that organizes a child, ever. Even if they're laughing, that's not organizing their system. You can still play the here I come game. We're going to get some deep pressure. Right? Our goal is to help children make sense of their systems. So along with vestibular and proprioceptive, our touch gives us our sense of self. Our skin is our container of our body, right? It gives us our container. So imagine if our container of our body isn't working super great. Has any of you seen those kids that like their body is the room? Like they walk in a room and they've like literally touched everything or dumped everything in 12 seconds. Okay, sometimes that's a touch, that's a tactile. It's a tactile issue, where the kids that walk down the hall, they must be touching something at all times. Yeah, it's a tactile thing. If I don't touch something, I don't know where I am, literally. Kids who have to have their transition object. My son created a tube of toothpaste around for 4 months and he was 2. Yeah, this transition object of tube of toothpaste, right? If I don't know, if I don't have this, I am not in existence. It's a tactile system. We see a lot of this overlap with our kids with autism. A lot. So we want to be aware. We want to be aware of how we're providing touch information for our kids. Sensory bins. You guys have sensory bins in your spaces? Yeah. Okay. So with our sensory bins, right? So good. We have some of the kids who are like crawling in and like, they're in it, right? That's information that we need more than just hands. Support. We got to find a way to make it reasonable in some way. And then we're never going to force. You're never going to force touch, because for a child with a tactile defensiveness, asking them to touch whatever the 40s or the rice or the new sand might feel like if we were asked to touch a hot stove, right? Yeah, we can support engagement with the Orbeez for the sand. Ooh, look, let's look what it looks like. Let's use the spoon. What if we use the spoon to pick it up, right? We can help engagement, but we're not forcing. We're not taking hands and putting it. Same with like paint, shaming, training, all that goodness. Because all we're doing then is alerting that system and creating another feedback loop in the limbic system, right? That center saying, oh, that's not safe. You protect from that from now on, right? We do not, those are not the loops we want to create. We want to create different loops that say, I wonder what this is about. Am I okay? Right? We want to keep it up in and moving up towards the cortex. All right, so here's just some different tactile activities. I am in love with that classroom shading here picture. I've never seen that before. That is a very brave teacher. Yeah. Yeah, very cool. In our clinic, we do shading cream skating, but that's like with one child. It is pretty contained. That's like a whole nother thing. And most of those kids are really clean. Anyway. Okay, let's talk about auditory for a minute. So our auditory system, obviously we're interested in whether a child can hear or not, but that's not what we're looking at from a sensory processing perspective. We're looking at the ability to distinguish relevant versus non-relevant information in our environment. This is really closely related to our safety. So for example, if we hear a big sudden noise out in the hallway, I would hope that we all orient to it to figure out if we need to run. Right? That's what we want to do. Now, if we hear somebody drop their pen in this room, I would hope that we all right, nobody like jump out of their skin. Everybody's kind of like whatever, right? That is our auditory system being like, I understand that. I know what that is. It's over there. It's fine. Okay. If our auditory system isn't, well, that's understanding. If our auditory system isn't working well for us, that distinction, it's late, is not going to be really clear. The example being, I had a little guy with autism that I worked with a bazillion years ago. And he happened to come at like Wednesdays at 10 in the summer, and Wednesdays at 10 every week. They were mowing the lawn outside, right? And this little guy was incredible. He's incredibly auditorily sensitive. And he was not able to make sense of auditory information unless his vision was also being used. So meaning he could not make sense of the sound of the lawnmower unless he was looking at the lawnmower. And so we actually needed to change the session time, because we would go to the window and we would be like, oh, that sound is the lawnmower. Look, it's out there still. And by the time we moved across the room, the connection points of like, oh yeah, that's still the lawnmower, were there for him. Yeah. So we needed to be really thoughtful, and we really needed to do a lot of work around his auditory system in order to help him find safety. Some of our kids with autism have incredibly sensitive auditory systems, right? They're hearing like the buzz of the lights. They're hearing, I've had the what? The vacuum, right? They're hearing something down the hall. I've had some of my kids with autism tell me, my older kids tell me that they can like hear like the blood in their ears, like they can hear like some of their internal systems. So imagine that sort of noise happening all day long while you're being asked to listen, right? Again, another reason why using the visuals are sometimes incredibly helpful, right? Because we don't necessarily know which system is most online when there's sensory processing issues. And so we're going to support a couple of different systems. Often for our kids with autism, their visual system is the one that's most organized. Johnny, go get your shoes on, right? And they're just like running around the room. And you know, us as adults are like, no, go get your shoes on. Like, time for shoes. And if we step back and pay attention, some of the time it takes that 30 seconds of quiet in order for the auditory to come in and process through, especially when it's language, to go get the shoes. And so it's just something to consider. We saw actually a lot of possible adaptations that could have been given to the little guy with the features around that auditory piece, right? He was given a direction, but then there wasn't just a lot of time for him to process it and make an adaptation off of it, because the next direction had already been given, right? Do you want a banana or do you want to go to the classroom? And then I think it was like 3 seconds later, she picked him up and took him to the classroom, when potentially it could have come around to go on a banana, right? Which could have really shifted that whole engagement. It also would have been curious to me from an auditory perspective, if he had been given silence, what might have happened, right? If we had taken that sensory input of auditory away, if we would have seen a shift in how that transpired. So auditory can be powerful, not only to pay attention to what is coming in, but also to create silence, to create quiet. So our visual processing, obviously we are paying attention to acuity, but that is not the thing we're wanting to pay attention. We're looking at from a sensory perspective. It's our ability to filter relevant visual information. It also has our direct ties to our vestibular and our postural systems. So examples I see for kids when they're struggling with audit or visual information is this is sometimes that choice word stuff, right? When they go into a classroom and there's just like a lot of like amazing things to explore and they can't pick anything because there's so much visual, right? So that ability to see the blocks in the shelf of toys and be like, that's what I'm going to do, and go choose it. The ability to find you or your voice from auditory or you from a visual perspective in a room, right? Johnny, look at me, look at me, look at me, but they can't sort of find you because of what else is happening in the room. So again, these are just considerations when the visual system isn't working well. I once worked with a little set of twins, I think they were like 2.5, 3, with autism. Their sensory systems were fairly impacted. They were they struggled with processing sensory information, and I did treatment with him under a blanket for 6 months. That was the only way I could get he could find me in the room. The room was so visually overwhelming for him that was the only way I could get hey, Gretchen worked together tonight. That was the only way we could get sort of a connection point between us. I had to take away all of the other visual besides myself and whatever toy I had out. Sometimes it was just myself. And so that's a consideration when we're thinking about how do I get this child to attend to XYZ, is we might have to really start removing visual information so that we can get down to what we want them looking at. That is also why therapeutically, I'm not telling you how to dress, but therapeutically why I wear typically very plain clothing. I don't have a lot of things on me because I want the kids finding my face. If they really struggle to find my face, I want them to be right. I work with a lot of kids with autism and sensory processing disorders. So I really want them here and not anywhere else. Okay. Our visual system is what supports our imitation and then eventually our attention, right? So we have these cool things in our brain called mirror neurons. They're so cool. That if I clap my hands because of your mirror neurons, I'm going to clap my hands. If I stop my foot, there we go. Because of your mirror neurons, your body has the experience of stopping your foot. Because you see it happening. Yeah, so that's something that happens. She's getting at. That's something that happens because of our visual systems. Very fun. What do we do from a visual strategy perspective? First things first, these lights are really, really challenging if you've got visual processing issues. So sometimes I just shut the lights off or find alternative lighting if I can. Especially again, kids with autism, they can smell and hear many of these lights. I don't know if these are like the special ones maybe, but they can smell and hear fluorescent lights some of the time. So we want to pay attention to that. So that little blue covering is just filtering out some of that light. Creating small visual spaces. So somebody must have taken a cabinet and put a curtain over it to create that small visual space so that the child can attend. And to take away some of the input. Activities, toys that are behind, that are obscured, sometimes is incredibly useful if children have a hard time with visual discrimination. So that's what this third picture is showing. It's showing like a really visually organized environment, which is going to be incredibly helpful. I know from my kids in my home when they were young, they both had some sensory processing challenges. I had to only have out about half of the toys at a time, because if I had more than like 5 or 6 choices, they wouldn't play with anything. And so I learned very early as a mom that I really needed to parse down and then rotate, because it was just too much for them. And I had to get one toy out and put it in the middle of the floor a day, because they couldn't even make a choice visually if it wasn't incredibly obvious. Now, if they chose something else, fabulous. But that was a way I adapted the visual system for them until they were able to do it themselves. Gustatory is our sense of taste. Gretchen here has the different parts of our tongue processes taste differently. So that salty is on the tip of the tongue, and bitter is in the back. What we think about from a gustatory perspective is what kids are, right, this is going to impact kids who are picky eaters. It's going to impact, it also can be used as a strategy to some extent. Sometimes salty, or sorry, sour, bitter, spicy will help alert the system. Some kids really seek that. Some kids, right, are very bland food kids. That is going to overwhelm the system. Olfactory or sense of smell. Olfactory is an interesting one because it has the fastest pathway from our nose to our amygdala, right? That's that safety spot in our brain, and our hippocampus, which is our memory center. So smell is going to most quickly get up into the system. And so sometimes we see very fast reactions to smell, and oftentimes we have no idea it was because of the smell. It's also strongly related to taste. It is something that can tie us into our attachment and our relationships really, really quickly. It also helps us orient to our environment, right? So like this all happens for us, like at lunchtime or whatever, when we start smelling food and we're like, right? What's our sense of smell? Kind of orienting us to our next steps. There's, the experiences of babies. I'm not going to do the video because we're running out of time, but babies who will be very, very dysregulated and who will be given a shirt or a blanket with their mom's smell on it, and right, will immediately calm. Right, this is how impactful that sense of smell can be based on our memory centers. Right, so that's an example of our memory centers. That smell kicks in, and the memory centers go, "Oh yeah, that's right. I'm okay. I'm safe. I got it." Or, "Uh-oh, I'm not safe." And that's what we want to, where we can sort of see some things happen. And then the last one is our interoception. This is our internal sense. This is our felt sense. This is our gut sense. That is most basic. This is what tells us it's our hunger, satiation, right? This is what gives us our gallbladder control, our heart rate, our understanding that we need to take a big deep breath. If our interoception, if we're tied, and this is embodiment for adults, right? If our interoception is turned on and working well, we can be like, I'm kind of full. I'm okay right now. For some of our kids who maybe have had trauma histories and who that hunger satiation that cycle hasn't been supported, right? They maybe haven't had fed when they're hungry. That an adaptive strategy is just to turn that right off, right? I don't need to pay attention to hunger because it's not going to be met anyway. This is that sense that we get like when something's wrong, like, ooh, something's a little off. This is our interoceptive sense. It also is the thing that tells us like if we have pain in our body and where it is. Some of our kids can be really, really like challenging behavior. This happens again with our kids with autism all the time. They can be really like out of control, behaviorally really challenged, really struggling, and we'll find out they have an ear infection. Right, and there was they didn't attend, they couldn't either communicate it or didn't know that there was pain happening in their body, wasn't experiencing it in a way that was organized. Yeah, so intersection is a big one. So what we're looking for as kids are growing and organizing through their sensory systems is we're looking to continue to provide the just right challenge. And what the just right challenge is information comes in. Auditory, visual, movement. It's processed, meaning like, I just fell off the stool. Huh. We do something about it. That's our praxis. We do something about it. Like, I should stand up and climb back up on that stool. And then we know, like, oh, when I'm on the edge of the stool, I probably need to back up. That's that just right feedback loop, right? We all know the child who like falls off the stool and then just is like, "Wah!" They don't have a plan of like what to do next. They can't figure that out. That's when the just right challenge is not. We don't have a just right challenge. It's too big of a challenge, right? So this is where we step in and support in some way. So this is sort of our goal. And this is how development really happens from a sensory processing perspective, is to be challenged just enough that there could be a shift or a change without totally overwhelming the system and either putting it into a fight flight response or shutting it down. Co-regulation. So I've alluded to regulation quite a bit. There isn't a slide about regulation. Regulation is our body's ability to have the just right alertness to what we should be doing in our environment or what we are doing in our environment. Now is a fabulous example, right? It is 8 to 10. We have all had long days. None of us are incredibly alert right now, right? Like we're at the alertness level of like sort of being curled up on our couch where we're trying to take new information in that maybe requires a little bit more alertness. Right, and so many of you are using lovely strategies, getting up, drinking water, wiggling your leg, knitting, right? You're using strategies to increase your alertness for the context of what's happening right now. Okay. We all do this. This is normal. Our alertness, our regulation goes up and down throughout the day. What we want is we want an adaptive system that's able to move up and down. Right? We should be able to shift to change throughout our day. The way regulation happens is through sensory input coming in. We can shift our regulation state with sensory input. But the magic trick is shifting our regulation state through co-regulation. So co-regulation is my regulation state talks to your regulation state and can change it and shift it. And yours can change that, which is really good, right? So I can give you my regulation. I can support you through my regulation, which is why I started with what works for you. Because our magic trick of regulating our kids is regulating ourselves. Right? If we can inherently shift our regulation state up and down, we can find a child, match a child, let's say they're really upset. And then we can help our regulation states to pull them back into a more regulated state. So I'm going to reference that peach video at the beginning, right? That little man was very upset that people dropped his peaches, right? A way of co-regulating him through that experience might have been for that teacher to not do what he was doing. I'm not asking her to like lay on the floor and cry about the peaches, but to like start at the state he's in, like, oh, you're super upset, right? And then for her to be able to regulate towards something a little bit more adept, right? We also saw it when she brought him into the classroom and he was like throwing things. She was staying very zen-like and very calm. She had a little upset right when her hand got hurt. But he was mad in that moment. A co-regulation technique would have been to be like, I see you. I see how frustrated you are. You see how I'm regulating up a little bit? So that he could be like, ah, you do see me. Now, we can pull our regulation state back down 99% of the time a child is suffering. So this is the, like, co-regulation is literally everything. I could talk for 4 hours of co-regulation. This is what I do with my parents. It is so. If you can get a really, really adaptive nervous system yourself, you are going to be able to support a regulation through it. Co-regulation is also our basis for survival and development of social and emotional skills, which is a whole other 4-hour topic. This can happen in the opposite way, where children will adapt and change in order to help their adults stay regulated so they can get their needs met. That's not what we want. Obviously. So we co-regulate back and forth. It goes 2 ways. This is a 2-way street. Let's talk for a minute about sensory processing disorders. Right now, this isn't recognized in sort of the diagnostic manuals yet. In the United States, it was almost put in, and it has quite a bit of research around it at this point. So it becomes a disorder. I don't know if she describes it in here, when it impacts a significant portion of function in many areas of life. There are sensory processing differences that we all have, right? So this is a continuum. Disorder is way over here, but we're looking at differences all up and down the spectrum. Okay. So Jean Ayres is the person who coined sensory. She actually coined sensory integration disorder, but now we call it sensory processing disorder. She likened it to a neurological traffic jam, right? So this sounds something similar to our autistic brain. Different, but there's a lot of overlap here. That prevents certain parts of our brain from receiving the information needed to interpret sensory information correctly, right? So this is where touch might feel like fire when really it's something wet. Inefficient sensory processing leads to functional deficits. That's why we care. As OT, I'm looking at how is it impacting function? How is it impacting the child's day, right? So the example of the airplane is impacting the child's day because they're having a meltdown consistently when this input happens. That's not functional. We got to find a way around that. We got to do something with that. If you have a child who just really likes to move and it's working and they're able to function throughout their day, so be it, right? I need a lot of movement in my day and I can function fairly well. I just know that I need a lot of movement. So this is how sensory processing disorders are sort of like divided out at this point, that we would look at when we're kind of in a evaluation sort of area. Some of them are more movement based, some of them are more regulation modulation based, and some of them are more system based. Some of the research that Gretchen had pulled, about 5 to 16% of children are affected by sensory processing disorders. It can occur with other diagnoses. The other diagnoses that we see is obviously autism, ADHD, trauma here, trauma. Is another one where we see a lot of sensory processing differences. In children with autism, sensory processing disorder can affect 40 to 90% of the population. I don't, gosh, in my career, I think I've seen 2, maybe, folks with the diagnosis of autism who didn't have just some fairly extreme sensory differences that didn't mean it was always impacting function, because some of them found love of workers that were really working for them. But it was impacted. There was a lot of sensory processing differences. Oh, and then the strengths that we see is visual practices, that ability to like visually manipulate things in our minds. And then there's often very, very significant differences in imitation praxis. That means the ability to copy what somebody is doing. is sometimes incredibly difficult with our kids with autism. That's that cerebellum that we were talking about earlier. That there's impact over cerebellum in kids with autism. That's why those things are popping up in the way that they are. And then the heightened amygdala, that's that sensory reactivity. So this is just a little bit of research that children with SPD show specific reduction in the white matter microstructure, primarily affecting the posterior cerebellar tract. So really what this means is that we're showing a reduction in sort of the brain matter that lets the impulses come up from the body into the brain, right? So there's actually differences in how they're coming up and down. What we see with sensory processing disorder, so there's a bazillion things we can see, but here's some of what we see, right? Toilet training difficulties, overly sensitive to different stimuli, maybe unaware, difficulty learning, unsure of how to move body in space, in constant motion. Might see difficulty making friends, intense, demanding, incredibly hard to calm, struggling with transitions, right? We might see like slumping, we might see just a lot of like puddling kind of behavior or body movements. Speech can be impacted, delayed response to verbal instructions and picky eating. Now, these things that you see can also be other stuff, right? It's not just sensory processing disorder, but it could, right? So these are some of the things that when you see this, it's like, oh, I wonder what's going on, right? And then having people take a peek who can kind of help parse it apart is useful. Here's some signs of dysregulation in a child: changing in breath, change in heart rate, frequent urination, clammy, cold sweat hands. This is something you can observe in kids, right? That gives you some clues. I mean, sometimes it's fairly obvious because there's a big old meltdown happening, right? But if it's not so obvious, some of these things are useful. You can see it in color changing, flushing, ears turn red. For a lot of our kids, that's sometimes the first sign. Eyes change, right? We get big lazy eyes. I think that out to parents. I have kids looking in the mirror so they can see it themselves. Jerky movements, slow, inconsistent movements, playing on the floor, fisted hands, just shutting it off, right? Eyes, ears closed. So these are signs that kids are starting to dysregulate, where we might think about either adapting our environment from a sensory perspective, or we might think about adding sensory strategies. I'm going to skip that one. So we want to think about strategies that you already use every day. And does that limit or enhance what you offer your child? So, right. The reason she said this is because sometimes the strategies the kids need are not useful for our nervous systems and vice versa. It's important to be aware of that, right? It's just really important to be aware that our kids might need something different than us, and this is where we get to be really good at regulating ourselves. And then the goal of supportive activities is to head off problems before they start. So putting sensory strategies in during a dysregulation is almost never going to be useful. During a dysregulation, we're taking sensory inputs away because the child is already overwhelmed. Okay, so adding, let's push the ball when a child is already in a fight, flight, dysregulated state isn't always incredibly useful. You're not going to be able to talk about that. Let's push the ball is a useful strategy when we start seeing some of these initial signs that we just talked about. That's the time to do it, or better yet, to give it as options throughout the entire day. Right? We don't just wait until the child is right at the top of that dysregulation pyramid. And then when we're implementing sensory strategies, it's most helpful in a sort of in a classroom environment or across the board in a home. Is to just make the materials and activities available to everybody, so that our goal is that children, just like we know how, are able to have that internal like, I think I need to go wiggle a little bit, and then they go choose what they need, right? That's what we're eventually teaching as their frontal lobe and as their cortex turns on. And so that's why we want to just have these things available so that we can eventually get kids to that place. They're not going to be there until they're at least 7, if not quite a bit older. But we start young. We start young and supporting that. If ever first you don't succeed, try again. So sometimes what I hear so often is like, I tried it and it didn't work. The same strategy isn't going to work in every moment, and sometimes we need to try it a few times, especially if we have a child with autism who needs like the newness of it in general is too much. Okay. I'm gonna end here. Any questions? Anything you guys have questions about anything you need at this point? Okay. We're good. Thank you so much. You are very welcome.